Hello, welcome to the University of Hertfordshire. My name is Linda Knowles. I'm Senior Lecturer in Nutrition and Dietetics and the Clinical Placement Lead for the Dietetics programme. This presentation aims to give you more information about the practice placements on the dietetic programme. By undertaking these placements, you'll be able to appreciate the roles and responsibilities of dietitians working with health and social care settings and start to develop your own skills and behaviours through observation of dietitians and other healthcare professionals in practice and by participating in learning activities. As you can see from our indicative course structure, during each of your 3 years at the University of Hertfordshire, you will have an opportunity to develop and practice the skills required to become a dietitian in a range of practice settings. During your first year, you'll undertake a placement module. Using workshops and seminars, you'll begin to understand the roles and responsibilities of a dietitian. We'll start to consider what it means to become a healthcare professional and consider topics such as consent, confidentiality, and most importantly, how to communicate with your patients and service users. Through 15 hours of simulation, you'll start to develop these important skills in preparation for the 3-week placement, which starts in May. You can learn more about simulation in a separate presentation. The first year placement takes place in a social care setting. Currently, students spend 3 weeks undertaking this work experience in nursing homes which are based within the Hertfordshire area. During this placement, you'll be able to see how food and nutrition is prepared and provided to residents, how to communicate effectively with a range of patients, including members of the multidisciplinary team and residents who have dementia. During this time, the placement aims for you to consider the impact that care has on the resident and service user and the role that the dietitian has to play within these organisations. Undertaking this, students have learned valuable skills such as problem solving, time management and organisational skills, as well as developing empathy and compassion for their service users. Our second and third year placements all take place in NHS settings. All our placements within the NHS take place in the east of England, as you can see on the map here. Our NHS partners are based in a range of settings and include acute teaching hospitals, general hospitals, and a range of community settings. Your second and third year placements will be spent in different locations in order to give you a range of different dietetic experiences. Second year placement starts in March and runs for 13 weeks. It's part of an academic module which runs in semester B and is supported by workshops and 22 hours of simulation. The module uses case-based scenarios to help you to start to develop your dietetic skills. During the placement component, you'll be able to put these skills into action. You'll start to develop key patient-facing dietetic skills, including nutritional assessments, and using the evidence base to start planning dietetic interventions. You'll start negotiating interventions with service users and monitor patient outcomes. You'll be asked to take part in presentations to patients such as cardiac rehab and diabetes, as well as taking part in educating other healthcare professionals on topics such as food first and must. Throughout your placement, you'll be supervised by experienced dietitians who will help you to develop your dietetic skills. They'll provide you with ongoing and constructive feedback, and at the end of placement will assess your overall performance. These dietitians will help you to develop goals to work towards for your final year placement. Moving on to the third year placements. This placement takes place at the end of the academic year, starting in July and finishing in mid-September. This placement is again supported by a module with workshops and seminars as well as 12 hours of simulation. During these workshops, students are given the opportunity to reflect on and share their experiences from their second year placements. During the final placements, students will be able to experience a different practice setting and learn new skills from different dietetic colleagues. During this placement, the students will continue to develop their dietetic skills, and towards the end of their final placement, students will have the opportunity, with minimum supervision, to manage their own workload, and this will include a caseload of patients. Again, supervision and regular feedback is provided by a team of experienced dietitians who at the end of the placement will complete an assessment on your abilities, and this placement mark will contribute academic credits that will go towards your final award. During your time in second and third year placements, you will be supervised by a team of experienced dietitians who've received training from the University of Hertfordshire. They will work with you to provide you with support and to help you develop your dietetic skills and provide you with ongoing constructive feedback. This team of dietitians will also be responsible for your final assessment. Each of the dietetic departments has a lead placement educator, who is a dietitian who is responsible for overseeing your placement. Each trust has a University of Hertfordshire link tutor who will offer support to both you and the placement leads. They will also visit you during your Level 5 and Level 6 placements. All of our placements within the NHS take place within the East of England. Only those students who are primary carers for young children or for parents, or those who have a specific health need, are able to request a priority placement for a specific area. Students who fit into these categories are asked to select 4 trusts and will be allocated to one of these. They will also be asked to provide evidence to support this application. Unfortunately, we are not able to take requests by other students, and placements are randomly allocated. Students should note that they could be placed within any trust within the East of England. Having placements in the East of England means that for many of our students, you'll need to live away from home or from the university campus during this time. Some but not all of our trusts can help provide hospital accommodation. For those areas where this is not possible, students have stayed in a range of alternative accommodation, and most are happy to share their experiences of this with you. For those in community trusts, you may need to also get transport to take you to different placement locations. This may involve using your own car or buses or trains, as well as the inevitable parking costs. This is something that you should consider when applying for a dietetic course, and you may be eligible to claim some of these expenses back. You can check the NHS Business Service Authority website, and there is a link on this slide for further information on dual accommodation and travel costs. Thank you for taking the time to listen to this presentation, and if you'd like further information, please see our website, or you can email dieteticadmissions@herts.ac.uk. Thank you.